Good morning. Welcome to all the faculty and all the members who have come here for this conference of TASG, GE focused work. Organized by Dr. Bada, not organized by Yashoda, I am telling you frankly. Facilities are there, but somebody has to do it. I think probably he's done a good job. Birappa Garu, the director of NIMS. Initially, when he was at the time of appointment, the health minister is known to me. He asked me, how is Birappa ji? I said, he's a wonderful surgeon, sir. Please don't spoil him, making him as a director. Laughingly I told, but he has proved to be one of the best NIMS directors of present times. I heard of Dr. Palnavelu many times because anybody can have a name in a metro cities, but Coimbatore is not as big as Chennai or Hyderabad, but he really made a good name in that place. Very, very difficult, but he achieved it. Then the young doctor, Harish Gautam, president of TSG, please keep it up and see that these things comes very frequently for the education of the youngsters. Dr. Bada, I advise all the youngsters, please don't listen to Bada because whatever he says high-end surgeries. But the life is not always high-end surgeries. I request all of you, please understand, I am 75 years old. I have huge experience in the running of this hospital. There are 4 or 5 in Hyderabad itself. The cost of surgeries or cost of medical treatment is going up very, very high. It is not because of hospitals are charging more. This may look very expensive, but because volume is there, the charges is as much as the rest of the hospital. There is nothing much. You take, what is that called? Robo. Abhi 2-3 lakh ज़्यादा हो जाएगा. Please understand our society. We are serving a particular kind of society where they can afford our treatment. 50% will not afford our treatment, then rest is only insurance and then high-end people or upper middle class. If you can treat with lab, please try to do with lab rather than with robo. I mean, I am exactly telling what is opposite to what Bala is going to tell you because always it is technology will help you. I am not saying it won't help you, but you should also understand the financial strength or financial ability of a patient before you treat. Why we say is, you will give choice to the patient. What patient can take a choice is best one. But best one is costing more than what you should do. You will have a lot of agony in the mind. If I had money, I could have got a better. That agony we should not create for patients. That's my sincere request. And I am seeing a lot of youngsters, lot of girls and women, ladies and others. Please have some empathy to patients. You really need not have empathy or not, I don't know, but the way you speak, people should feel that you are comforting them. Because I tell you an example, there was one old lady, I think 20 years back, crying seriously in my hospital. I used to make rounds in those days. I asked her, why are you crying, Amma? What is that? No, tomorrow I have some surgery. She is 80 years old or maybe 85. I said, why are you crying? I may die. I said, what is your age? 82, sorry, 80 or something. She said. I said, fine, you lived your life. What happens if we die? So everybody has to die. She said, hey, what is this doctor telling me to die? No, I am not telling you to die. But what will happen if we die? Anyway, someday we have to die. No, don't talk like that. I said, okay, Amma, how many children you have, grandchildren you have, this and that. I said, don't worry, I know the doctor who is operating, I'll tell him. You also come there. I said, okay, I'll also come there. I went along with her when she was going to be operated. She doesn't know I am a director of the hospital. Then next day I visited her. She was quite happy because surgery went on uneventfully. And then we became good friends. She said, how are you? You are married? Are your children? I said, okay. Next day she asked, how much salary you are getting here? Old people will have a lot of inquisitiveness. I don't know what to tell. I said, at those times salaries was not very high. I told some 25,000-30,000 per month. So much for doctor, for making me to laugh, they are paying you so much. Huh? She thought I meant only for making the patients to laugh. I got upset. I said, this is a very difficult proposition, and I stopped going to her next 2-3 days. Because she liked me, she called the sisters. Chinna doctor ekkada unnandi, that's where is that small doctor, please call. Amma, he is not small doctor, I was director. Then you please definitely call her. Then the next day or 2-3 days I went there. She said, doctor, please don't think otherwise. I don't know you are a director now, that's why I asked what is your salary. I said, don't worry, I also don't feel. But you also don't feel when the bill comes to your hand that it is high. So she was very happy. You will not believe, she sent so many patients to me. So many patients. The point is, why I am saying this is, this kind of empathy connected to the patient is required even in AI era. They know more than us nowadays, that's what patients think. But even then, some connection of humanity will give lot of soothing effect to the patients, and it will give lot of good recovery. That's what I want to tell the youngsters. Directly or indirectly, most of the senior people are doing the same thing. They won't tell, but I am only telling because I have nothing, no secrets to be kept for myself. Thank you very much.